Okay, on the rankings themselves, the UK obviously comes in first, with Australia and New Zealand ranking very, very high. Of those 40 countries, the quality of care in the UK was the highest. Although the UK ranked very high and placed first in the index, their framework for health care, for end-of-life care, ranked pretty poorly. I think it's well recognized that the NHS has its issues, and I think that was reflected in this index fairly accurately. Developing nations, so we ranked a number of, say, developing nations in Asia, India, and China, and so on. We looked at Uganda, we looked at some other developing nations. There are some real challenges in developing nations with, say, the allocation of national accounts to healthcare. I think India puts 1% of its national accounts to healthcare. So, if possible, one of our concerns there is that there isn't really enough funding for healthcare in some of these developing countries. There are obviously a number of trade-offs that those countries are facing as well. On the overall results, as we said, UK, Australia, New Zealand came in the top 3 places. The Western European countries, obviously having a longer history with end-of-life care and more developed healthcare systems, ranked in, say, the top 10, 12 slots pretty accurately. It's interesting to note Hungary. I think there's more discussion about Hungary in the report itself. A number of Central and Eastern European countries have developed end-of-life care organizations over the past 10 years. Hungary and Romania, which wasn't included in the index but is discussed in the report, and Poland as well, have fairly well-developed palliative care strategies. In Asia, Taiwan ranked first. Taiwan ranked top in Asia at 14th, Singapore 18th, and Hong Kong 20th. Developing countries, it's no surprise, came in at the bottom. Mexico, it's interesting to note, does actually have a national palliative care strategy, end-of-life care strategy. So of those bottom-ranking countries, Mexico does have a national level plan. In terms of the basic end-of-life care environment, I think there really aren't any surprises here. The developed, wealthy Western countries have rank much higher, and the developing countries that haven't been able to put much or comparative amounts toward their healthcare system don't rank as well as Western countries. Singapore ranked 29th. This has quite a bit to do with the amount of GDP that's put toward healthcare, but that's no surprise given the size of Singapore and the size of the population of Singapore. On the availability of end-of-life care, again, UK, New Zealand, and Australia came in top. This really has to do with how accessible is end-of-life care to those who need it, particularly those over age 65. So we're also looking at things like the National Palliative Care Strategy in this category. Places like China, Russia, and so on rank at the bottom because they simply don't have the access to patients there, don't have the access to end-of-life care that they do in the more developed countries. One thing I'll note here also is if you look at, say, South Africa ranks relatively well, and there is a bit of discussion in the report on South Africa and Uganda and the development of end-of-life care organizations as a result of the HIV/AIDS epidemic, very community-based care systems in those two countries. On the cost of end-of-life care, again, the countries here that rank highly are those that have national health systems where there is very low out-of-pocket for the patients and their families. The countries that rank low here, it's no surprise that the United States ranks pretty low here. I think a week's stay costs over $10,000 in the U.S. The next highest country, I think, is $100. So the U.S. is actually quite expensive for end-of-life care. On the quality rankings, again, this is looking at indicators such as public awareness of end-of-life care, doctor-patient transparency, training in medical institutions, availability of painkillers, and so on. The UK, Australia, New Zealand rank very well. Countries like India rank poorly, partly because there really is limited availability of opioids and painkillers in India. So looking at that one element, as Dr. Goh mentioned, pain management is a key issue in the quality of end-of-life care, and one that we looked upon pretty highly. Looking at a few specific countries, I wanted to cover 3 specific countries. I'm sure there may be more questions about other countries, but we wanted to look at a few where we figured there would be some very specific questions, and we can look at others as needed. First, the UK. Obviously, the overall score in the UK is first, and the UK ranked very well in availability and quality of end-of-life care. And those are the most highly weighted sections within the index. The cost of end-of-life care, the UK was kind of at the middle of the pack, given the out-of-pocket that's required, and as Dr. Goh mentioned, kind of the charitable support required for many palliative care organizations. The basic end-of-life healthcare environment, obviously, again, because of the NHS issues in the UK, it really pulled down the UK in that section.